Hurricane Beryl has impacted many countries and it continues to do so. And it's leaving many individuals facing numerous challenges, especially those managing chronic conditions like diabetes and hypertension. Effective management becomes even more crucial in such times to help prevent complications or worsening of existing conditions. Post-storm conditions like flooding, utility shortages, structural damage, transportation challenges, and other limitations can significantly hinder access to food, medication, and supplies critical for managing these conditions. So here are some practical tips and considerations for managing chronic conditions in the aftermath of a hurricane. Firstly, remember to take your medication as directed by your physician, especially during this challenging time. If you're running low on medications, even though most pharmacies are reopening, just remember that you want to verify their status before visiting. Contact them or check the pharmacist's social media pages or website for updated information on their hours and availability. This stress and disruption can also lead to forgetting medication schedules. So if you're unsure, just call your healthcare team and pharmacist for some guidance. Many persons with diabetes are on insulin, and so proper storage is essential to help maintain its effectiveness and safety. So ideally, insulin should be stored in a refrigerator at temperatures between 2 to 8 degrees Celsius. However, many persons are still facing power outages, and so this may not be feasible. So here's some additional information that can be helpful. Insulin can remain effective at room temperatures, which is around 15 to 30 degrees Celsius, for up to 28 days, except for insulin that has been diluted or removed from its original vial. Those should be discarded within 2 weeks. Now, sometimes even that is impossible, especially during this heat. So in hot temperatures, consider using an insulated bag or a lunchbox with an ice pack or bag of ice or frozen food in it like frozen peas. Just ensure that the insulin itself does not come in direct contact with the frozen foods or materials because you want to avoid freezing. If insulin becomes frozen, do not use it. It does lose its effectiveness. Also, remember to check the expiration date on your vial. So if you're unsure of your viability or storage, again, feel free to contact your pharmacist or healthcare team. Now, during this time as well, the stress of a hurricane and its aftermath can take a toll on you, not just physically, but also mentally, leading to anxiety, concerns about family, finances, and loss of property. These stressors can worsen chronic conditions from raising blood pressure to raising blood sugar levels, therefore making management even more challenging. One thing to note though, it is normal to feel overwhelmed, stressed, or worried during this time. So allow yourself to acknowledge these feelings, but without judgment. And to help during these periods of anxiety and worries, it's important to try and stick to your usual schedule or routine as much as possible. Talk to or seek support from friends, family, or professional counselors, and practice self-reduction techniques such as deep breathing, reading, listening to music, something that helps you to relax. Injury prevention is critical for individuals with chronic conditions, especially after a hurricane when the risk of injury is heightened. Individuals with diabetes, particularly those with uncontrolled blood sugar levels, experience delayed wound healing. So a seemingly minor injury, such as a scrape, can lead to serious complications from infections to losing a foot or even death. So here are some tips to help prevent injuries. 1. Avoid flood waters. They may contain hazardous objects and contaminants. 2. During cleanup, remember your protective clothing and shoes to help prevent cuts and bruises. 3. When using tools, especially power tools, including the protective goggles to help prevent any eye injuries, as eye protection is often overlooked. During the preparation for the hurricane itself, there were many incidents of eye injuries presenting itself to the hospital. Some persons lost their sight. If you do end up with an injury, seek immediate medical attention. Foot care and regular foot inspections are so crucial for persons with diabetes, especially since many have reduced sensations in their feet and may not feel or recognize injuries. So don't go barefoot even indoors. Inspect your feet daily, looking for cuts, bruises, or any signs of injury. Check between the toes and use a mirror so you can see the bottom of your feet, or ask someone to take a look for you. With the additional stress and limited access to food and resources, maintaining regular eating habits can become challenging. And irregular eating habits can significantly impact your blood sugar levels. So during such times, it may be necessary to test your blood sugar levels more frequently than usual to help monitor for fluctuations, especially if you rely on insulin for diabetes management. Also, during this time, variations in your blood sugar readings and blood pressure readings are common, so it's important to not be too hard on yourself if the numbers are slightly off. Now, managing hydration and nutrition again can be challenging when food and water supplies are disrupted. So, here are some tips to help make things simple. Keep meals simple and balanced. Aiming for meals that include a combination of protein, healthy fats, and complex carbs, such as fruits, vegetables, and whole grains, can help to maintain blood sugar stability. So, an example of a simple meal can be a can of tuna with whole grain crackers and a piece of fruit. During disruptions, stocking up on non-perishable items can also be very helpful. For example, canned vegetables, canned fruits or dried fruits, canned protein like sardine, tuna, chickpeas, black beans. Just be cautious of the salt content in canned items. Check more for low sodium or no salt added for variety, or if you can't get that, you can also rinse them off with water before use. We do know right now that access to safe drinking water as well can be limited. Also, you want to ensure you have access to safe drinking water. Stock up on bottled waters and also follow recommendation from authorities like the Office of Disaster Preparedness and Emergency Management, which advises boiling all drinking water until informed otherwise. Lastly, stay informed and know your local resources and organizations, as these can help provide additional assistance and information tailored to managing diabetes and other chronic conditions during these emergency times. Now, managing chronic conditions and mental health in the aftermath of a hurricane can present unique challenges. But with careful planning and preparation, you can navigate through this period effectively. Just remember, prioritize your health. Stay informed, stay connected, seek support from your healthcare professionals and local resources. So be well and stay safe.